There we go. Someone did that for me, I think. As we think about investment adjustment, I'll spend a little bit more time here because I think at the core of what we do in this space is accountability, right? Accountability for individuals as defined by this kind of willingness or obligation to be responsible for your actions, right? But as we've been working together with this, with our courts and with our sheriff's department, I think I'd be remiss not to mention that the accountability in our thinking is more about accountability as a reciprocal process, meaning that for every expectation we have on individuals in this space, or any unit of expectations of accountability in this space, is that we believe we have to provide an equal and unit of support to build capacity to be held accountable. In other words, there's reciprocity in the way we think about accountability, which is not just, you're responsible for your behaviors, but what are we going to do to support you and changing some of those behaviors? So it's real equal unit of support and accountability that we've really managed to kind of think about how we look at policy and how we look at support systems along the way. I'll start with the pretrial pre-booking module because this is important for the general public, and I know a lot of our city council and boards are familiar with this. But in 2019, there was a concerted effort by the county to reduce the jail population. Right. At that time, it was through some grant funding, but it was the population in the jail at that time was about 75% were felony arrests, about 25% were misdemeanor arrests. Right. And there was a lot of pushback by the community at that time to say, why are we having people who are committing misdemeanors staying in jail for so long? Right. Isn't there any other ways to look at this? So through the work on innovation with pretrial services, which is a function of Superior Court, we're able to stand up what we call our pre-service trade trial service pre-booking modular. You'll see that sitting right outside the jail. It's staffed by pretrial staff, funded now by the county at that time from the grant. So we transitioned to that. But the idea there was to give staff in pretrial services through Superior Court the ability to actually cite and provide a court date to people who are committing lower level misdemeanor offenses, non-domestic violence, right? There was a matrix that was created collaboratively to determine, so the person at the desk could determine, hey, can this person be released? And if so, we can give them a court date and they can move on. Working with all the jurisdictional partners in law enforcement, we made that a first stop for all misdemeanor arrests. As a result of that, I can say that the current ratio in population of jail is around 95% felony to 5% misdemeanor. Not only has it kind of created a situation where we've got where people feel more comfortable with who's in there, right? That they're a danger to the community, but equally important, it's also saved a lot of our jurisdictions funding from booking. Right. I mean, it's I believe for city of Tucson, it's about between 1.2 and 1.8. It's moved in terms of the pricing of that a year in savings because we're avoiding these people being booked and staying the night in jail, which is a cost. So it was twofold, right? It was really trying to make sure that we are balancing who needs to be incarcerated with this idea of is there a potential savings for the jurisdictions in this space, which was super important. What we discovered, though, as a result of that is that because people are now going there at whenever they're being arrested and being released, that we had a lot of people being released in the community at all hours of time at the night, particularly in that area that we had concerns, the people who live in that area who were saying, I got people 3 a.m. coming and, just wandering or, going back and doing other things. So conceptually, as we began to work together and I kind of came into this role, started really thinking more purposely about this idea of warm handoffs, right? And you've heard that conversation a lot. And what does that really mean? This idea and concept around the fact that the criminal justice system is very, I use the term porous, right? I want to say it's broken, it's porous, right? There's, by the time a certain person's arrested, when they get their hearing, there's a lot of time in between those really important points for an individual to actually show up for the hearing, have their, have their initial appearance for charges first, then a week later, maybe have their hearing, then, the charges are read, maybe they're postponed the hearing. I mean, there's a lot of gaps along the way and voids that were communicated to me at the time by people who were very much in this space to say, hey, we need a lot more warmer handoffs for people, right? People aren't showing up to their court hearings, right? That continues to be an issue that plagues us. Failures to appear are a big problem in our community. People are not showing up for the court date. And guess what happens, right? They have a warrant for the arrest, and that just continues the cycle of issues. So we thought about this idea, okay, well, if we created a building that kind of sat adjacent to the pretrial pre-booking module that could capture people on their way out to really maybe hope and convince them to, not wander, to maybe get a ride home or get some services that they were going to need, was kind of the initial concept of the transition center, which is now in place right now. And the kind of the theory of action guiding that particular module was that the idea, if we provide recently released individuals from jail or arrest, right, with a trustee conduit, right, or resources of support, then we would significantly reduce recidivism for those who are committing misdemeanor offenses. That was the initial focus of and the theory of action that's driving that work, which was lived experience people, intercepting people, having discussions, and hoping we can convince them to get the services they need to show up for court, but also to maybe change some of their behaviors and their trajectory that's causing them to commit some of these crimes. The success rate that we're looking at data that told us that 25% of misdemeanor offenders were rearrested within a month. And that's the data that we were looking at, notwithstanding the concerns by the community. By standing up the transition center, we've seen that number reduced to under 10%, right? And those are just touch points. Not everyone takes up, the services, but there's follow-up, there's conversations. We now see people dropping by. We've expanded the role to become much more, some of the people that are actually leaving jail from felony arrests. That data is a little more wonky, right? Because some of them are released to pretrial because they've got a different type of court date coming on. And so we're working collaboratively with them to really see how we can look at the data in that space. It continues to evolve. I don't think we're complete with what the transition center is or can be, but I think it's a continued evolvement in this space. And I believe there's going to be continued dialogue. We'll talk about later of how Liz and I are kind of working to think more about that work and how we can continue those idea of warm handoffs to help people really not only get to court, but change their behavior. Because right now it's still not as tight as we'd like it to be. Warrant resolution, and I apologize, but I think these are important conceptual ideas that kind of came up. This really also was a concern. As you know, we have many courts, right, in many jurisdictions. So if someone's arrested in Marana, they may not realize, hey, I'm in Marana and I'm trying to figure out where I got to go to court. And you just had this, it continues to be confusion around what court do I go to? How do I do this? We have a lot of people in the encampments who have warrants out, who are maybe not aware, they didn't show up. So out of the push of, I know it was Chair Scott was pushing us, hey, let's see how we can expand a little bit about this warrant resolution. I know with our Justice Service, we work closely with pretrial to really begin to create some consolidation in the way we offer meaningful information to folks who have a warrant. Right, and have been able to, and it's not something we do as a county, it's actually done through the courts, but we try to ensure we can help connect them with those services and been able to quash a lot of these warrants that have been barriers to housing and been barriers to other issues as well. And so those are super, that's an important program there's not necessarily a cost associated with here, but I think I wanted to name it as just kind of how our thinking has evolved in this space and the roles, again, that we have thought about that we play in as we continue to move forward. Initially in this idea, and a lot of our community was really wanting us to look at median signs. That was one of the first things we did, right, to really start looking at ways to discourage panhandling in the corners. I know our colleagues have been also exploring that. I can tell it was an experiment. We were like, well, I don't know if it's going to work, right? We'll put them up there and see what happens. I can say pretty affirmatively that the signs have been helpful in those areas that we put them up with not people. I mean, every now and then I'll get a text from someone that has someone panhandling in front of the sign, right? Just to joke with me or something. But the reality, it's rare that you see that, right? And the idea wasn't necessarily an ordinance to say banning panhandling. It was really an ordinance here to keeping people from standing in those medians for long periods of time, which was a safety issue. So we really referenced that as a way to put those signs in place, and as such have seen some success there. But these are kind of these small wins that I thought were really important. I'm gonna jump quickly to this Title 36 amendment. As many of you know, in the state of Arizona, if a person is a danger to themselves or others, there's an ability to hold someone involuntarily in that space for up to 24 hours, right? And I know our MISS team colleagues at the city of Tucson have developed a protocol for that for people who experience crisis and have used the CRC for that purposes. The CRC is our building. We are the landlords of that building. We have no jurisdictional oversight on behavioral health other than we pay for court order evaluations, and I'll get to that a little bit later. But more specifically in here, the reason why I placed this on here as amendment is there was a lot of work done last year by the county in collaboration with some of our partners led by, at that time, it was Supervisor Lee and the Tucson Crime-Free Group and folks that have been partners and have interest in this space to really look at an amendment to Title 36 that would look more specifically at involuntary stabilization for folks who are experiencing substance use disorder. The current statute under Title 36 limits our ability to hold someone specifically to mental health, right? Although CRC is considered a no wrong door place, so people who are experiencing crisis, and it may be drug-induced crisis, CRC will not turn them away. They will hold them there 23 hours, try to stabilize. But after that, you cannot proceed with a court-ordered evaluation with a person if substance use is really at the core of their crisis, right? There are other states that have these on the books. Arizona does not. So the purpose of this statute, which was SB 1257, was to really try to create a real narrow way in which we could hold someone a little bit longer in the CRC for stabilization. That met a lot of resistance to at the legislative level. That was not passed, but it was kind of there's people on both sides, right, who have some concerns about involuntarily holding people. We really tried to thread the needle, particularly when it came to the stabilization for people at CRC, so that we didn't have an open process for people picking up people who are having substance use disorder. Even in that narrow strand, we had very little success. I know our county attorney is working on maybe picking up some of that and looking what that could look like with a lot more input from her and her team, seeing what we can maybe do in that space. But currently there is not statutory authority to hold anyone for substance use disorder. So that's just an important note as we're kind of thinking through where we go with a lot of this. Some of the programs that I think are important investments for us have been our INVEST program, no pun intended there, but it's our Detaining and Crisis Services division has really did a great job for working with people with mental health concerns and substance use who are actually sitting in the jail longer term, who have, waiting some sentence. So these are not people, as you know, our jail population, the vast majority of people entering the jail are released within 24 hours, right? That's just, they sit in the pit, they're just, right? That makes up a good chunk, right? But then you have people who are waiting trial or are waiting or have not been able to post bond. Most of their felony offenses where the initial appearance judge feels like this person needs to be held because they're a danger to the community, right? And that's the authority that our judges have as independent judicial authority. So what the INVEST team has done has really been looking more long-term at really addressing those people, building relationship with folks so that as they exit the jail longer term, that they have a connection point to actually get into a housing and a continued treatment program. I can talk a lot about the successes they have, but that has led to a little bit to better services for release planning. So a lot of systems that have been built through our detaining crisis services department, more specifically with Invest and these exit planning have been great because they have resulted in people not having that gap, right? Warm handoffs, right? We keep talking about that, but people sometimes leave the jail and they got no place to go, right? And so this is kind of has helped at least with that sliver of folks who are experiencing those two concurring issues that I explained earlier. And then lastly, kind of in this space, I'll just kind of jump just quickly to the idea of the STEPS program. I know under our county attorney, that continues to be an area that I think we want to continue to invest in. It's a diversion, right? Pre-indictment diversion program that has had great success. We've helped at one point, our state reduced the amount of funding for probation officers 3 years ago, 2 years ago. And so we were able to kind of use county funds to help support that because many of those programs are going to be cut where probation officers are assigned to STEPS, right? Because you still need a probation officer to make sure they attend some of those. And so some of these investments that we made and continue to make have been to offset some of the state cuts for probation officers that were essential in these areas that were not necessarily people that are being released from jail, but were assigned to programs that were important for diversion. So I just want to name that as I transition to the kind of last section here. Someone may need to help me. I got and lastly, kind of in the area of public health, there was a memo that was submitted by the health department. It was attached to agenda, which was talked a little bit about the work that the health department has done since 2018 in this area, particularly as it relates to substance use disorder. The community mental health and addiction program over time has invested, and I'll bundle some of these first 5 bullets, over about $14 million over the past since 2018 in this space, right? And a lot of it has been in these areas of education, mitigation, kind of engagement efforts, and monitoring, right? And so education, again, prevention from housing to this work that we're doing in the opioid space, I think continues to be an important area that we want to continue to invest in. The education of young adults about the harms of fentanyl, of community, talking to people, is a huge investment that we've made in that area. When it comes to monitoring, we also made a huge investment in monitoring opioid deaths. We now have a dashboard. You can see how many people are dying from opioid overdoses, and we've been tracking that. With some of these harm prevention efforts that we're invested in, Narcan distribution, fentanyl strips, we've seen a decline in that, but we're starting to see some concerning data about maybe that picking up. Some of the fentanyl that's now, the carfentanil that's out there, it's made our way to our community where Narcan won't get someone out of that trouble of that for overdose. Those are becoming more and more prominent and becomes a concern. So we're seeing some uptick in that space and are exploring that. One of the things the health department and I have had a more recent conversation about has been of the idea of evaluating the impact of this work. I think from 2018 till now, I think we've done some great work and we'll continue to make some efforts in that. But we're talking about having an external evaluator come in from CDC and maybe somewhere else to really review what we're doing, right? Because I think we all are perplexed by kind of how do we fix this, right? And I think one of the things I know our health department has been kind of their mantra has been, hey, if we can do it better, let's do it better, right? And so we are going to invest in kind of a review of the work to date and see if we have to strategically abandon some of the efforts and do something different, right? And so that's kind of at the stage that we're at in this investment as we continue to receive some of the overdose to action funds to see, do we need to pivot some of those monies? Is there another area that we should be investing in to make sure that we're addressing some of the currents that we're seeing currently out on the streets? You see, one of the other areas, and I don't see Chief Kazmar, that one of the concerns that our community had, there were a lot of overdoses in the jail not too long ago. We had community outrage about it, right? And I know the sheriff, we worked with our sheriff's department to up their staffing in the jail. But one investment I think gets lost is that we also invested $3 million to actually have MAT services in the jail. For those who do not know what MAT is, it's medical assisted treatment. We know that a good chunk of individuals who are committing crimes have a co-occurrence with some drug addiction, right? And so rather than kind of wait and see who self kind of says, hey, I'm addicted, we've created a kind of a universal MAT services for folks across the jail. It's cost us some money. It's been a considerable investment, but it's really, I mean, we haven't had an overdose in the jail since we kind of put this in place. That's the real data that I think is really important as we're looking at that. But it comes at a cost, right? It's not necessarily that we're investing that in people on the streets, but the people that are in our community. I think it's important that we know that we're looking at incarceration, right? We don't want people to die in our hands, right? And so that's been a really important investment that we made in that space. And NAFCare, as controversial, we're exploring whether we bring that investment in-house. We did make an investment about 2 years ago of additional $5 million to really address some of the concerns that were brought forth by TPD in relationship to medical rejections. I have and I'm showing this with Liz, I have a folder of medical rejections that we keep now as a better understanding. But at that time, there was a concern that the amount of people that are being arrested for fentanyl and getting rejected and having to be taken back to the hospital, just for the general public. There are cases that where people are being booked in jail and are medically rejected, where they have to be taken to an ER to be looked at before they are able to finish the booking process. And a lot of it is just some real serious health concerns. Fentanyl was one of those. And so we invested in additional staffing and medical staff that has allowed us to actually not have so many of those being fentanyl related. I think we've been under 10 a month, roughly on average, since January as a result of that investment. Medical rejections for that particular. And so that's a huge investment. And then just to again restate, we pay about $3.4 million annually for court order evaluation. I just want to make sure, because there's some misunderstanding of this space, is that our statutory obligation for people who are experiencing crisis is the court order evaluation period for folks, right? So I'm experiencing crisis. For mental health, I go into the CRC. Those first 24 hours are not paid by us. It's a county tax. It's taxpayers paying for that. But after that, if there's a concern by the medical staff that they want to evaluate that person for a longer term stay, then there's a whole petition process that's part of that, working with our county attorney's office to really hold that person for longer than 24 hours and evaluate them. During that evaluation period, the county pays for those days, which people are being evaluated and being held involuntarily. And then the decision is made whether they have a longer term treatment or not. But that's just clarifying what our investment is. And then lastly, just kind of some of the work more specifically in our infrastructures have been the opioid settlement funds that we're working collaborative on. Today we have on our agenda later this afternoon when we return at 7 p.m. will be our Safer Center to begin to explore ways to fund current detox vendors who are in our community to really enhance some of their detox facilities, to allow people to stay a little longer, maybe keep some pets, keep some belongings. So it really is an effort to really expand efforts in that space to see if we can bring some kind of motivation to people to stay longer. But I'll stay with that. I apologize a little longer, but I thought the context of the thinking I think was important given some of this laundry list of things. I thought it was relevant to give a little bit of an explanation of how we've derived at some of these innovations and ideas and funding mechanisms here. And I'll turn over to my colleague, Liz.
Good afternoon, Mayor, council members, Board of Supervisors, and staff. It's a pleasure to be able to share with you the work that we're doing at City of Tucson. I want to start off with, and I'm sure you're all familiar with our Safe City initiative that was just launched recently. under Mayor Romero's leadership in response to the growing concerns. We've been working on so many things for so many years, but there seems to be a real nexus of some of these tough issues, the rising unsheltered homelessness, the increase of substance use and mental health challenges, limited treatment and shelter options, and declining perceptions of public safety and the reality of some of those public safety concerns. And then the visible blight, the trash, the things that we're seeing as a result of a lot of these encampments and just people loitering around. So, as a city, we have done many things over the course of the last 6 years. We've seen implementation of several new services and efforts. And we know that all of these things have been happening in multiple spaces, but this work of Safe Cities really to bring it all under one umbrella, to be better coordinated, to be looking at what is working and of course change on those things that are not. The city, we have been operating in spaces that are not traditionally city services. And yet we know that these are urgent, immediate needs that we have in the community. And where can we plug in? Where can we help fill some of those gaps? And I want to acknowledge our county partners and the departments who have been through all those long discussions and brainstorming and how do we work together. And there's many efforts, more than not, that we're working together. So I'm grateful for the work that we get to do together. The goal of Safe City is really simple. It's improving public safety and enhancing the quality of life for all Tucsonans. And so the work I'm going to do, I'm going to take a little bit of a different approach than my counterpart here around what are some of those things, because you should have all received a similar spreadsheet, a little larger with a little more colors. And then an additional packet really goes into more description of what those programs are. So for the general public and any of you that would be interested in what does that look like and what does that mean? So knowing you have that material, I will not go into the detail, but provide some of the high level understanding and some examples of this work that we're doing. So we know we have a housing and community development department. We also have a housing first program that the mayor and council brought in 2020 and has really grown since its inception to do many things. We do outreach and navigation. We have purchased properties to do low barrier shelters. Not all of them are operated by the city, but we own 5 of them. And with our American Rescue dollars, we spent 21 million, thank you to Mayor and Council, for that investment, because those have become lifelines for many of our unsheltered neighbors. We also have programs and services like our multidisciplinary outreach team, which partners together our city outreach team, OPCS, Behavioral Health Services in El Rio, with medical services. And they go out to encampments and to places where there's unsheltered, and they provide basic care, and they also provide some immediate medical assessments and trying to get them connected back into the community. That has really become a very powerful organized effort. Today, many of you may have heard of 100 Acre Woods. Today was our 3rd phase of decommissioning that area, which has long been known as a large encampment area. And the effort, the compassion, the work that we have done to really engage with those who are living there, and so many of them, we've been able to connect them into recently renovated Amazon Motel, about 70 individuals to that location. So today was an important event today for us to finish that work and then continue to help them in their housing or whatever other locations we've been able shelter, other options that they took. I do want to acknowledge in that work with 100 Acre Woods is TPCH, Tucson Pima Collaboration and Homelessness. That planning body has been very involved and brought together countless providers and agencies to work together to serve them. So again, everything we do is in collaboration. Next, around safety and accountability, the work we do around community safety, health, and wellness. Again, another effective program that has been was in the last few years by mayor and council to say, let's do. How do we get the right work in the right hands? How do we take the work off of our public safety frontline staff and use it to connect people to those social supports and services? And so that work has grown as well and changed and evolved to be as impactful as we can get it to the people who need it the most. So as an example, we have care coordinators who receive referrals, whether it's through our 311 line, through our various providers, mayor and council offices, as they identify people who are in need. Our care coordinators are connecting them to social services that are already existing and working with whether it's health, mental health, behavioral health, substance use. And we've expanded to take advantage of some of the funding through the state around opioid response to do education and to really help people with opioid substance use disorders. I also, the work that we've done with VIVA, which stands for Violence Interruption and Vulnerability Violation Action, came out of an effort that Tucson Police Department piloted. It was geared to reduce gun violence. Highly successful because it wasn't just about disrupting or dismantling those crime networks in those hot spots that were identified where there was high gun violence. It also was about supporting the residents in the neighborhood in that area. And that has been very impactful through our community enrichment coordinators and subsequently has led us to implementing an Office of Violence Prevention. And so that work will continue to grow and with the goal of really working to keep our community safe and also holding people accountable. Our Tucson Police Department, I could give you a whole day's talk on all the work that Tucson Police, very proud of the work they're doing. I just want to talk about the core team and their mental health team, the work they do to proactively engage with unsheltered persons, with some persons with mental health issues or crisis, those who are actively using and really putting that warm handoff as to what can we do to help you and let's get you where you need to go. And so that work has really been impactful. We often have our outreach workers embedded. We also have Kodak and Community Bridges embedded with our core team to go out there so that when they're meeting with them, they don't have to say, show up to this place. They have the staff on site ready to work with them. Yes. And so prevention and community pride. I want to say prevention. We need more of that. And I appreciate and grateful to the county for some of that work around eviction prevention and really trying to help people who are in crisis. We also have additional work that we do there with our crisis call takers. We have embedded crisis call takers in our 911 center. The 311 has also proven to be a lifeline where people are maybe not having an immediate emergency event, but obviously have issues and concerns that need help. And so having a combined 911 center, 311, and crisis call takers has really made us very effective in addressing people as they're calling in. Our Tucson Community Risk Reduction, which is under our Tucson Fire Department, that work is critical in providing education and interventions. They've reached more than 25,000 residents last year. As an example, one of those programs is our TC3. It's a collaboration with Tucson Medical Center, really serving the very medically vulnerable. So these are things that we're doing to really reach people before they get in a place where they're in crisis or are on the streets. I do want to mention our Thrive Zones. This has been an effort to, some will use the term community revitalization, but really what it is an area. We'll use Thrive in the 05 and the 29th Street corridor are two Thrive zones around investing into those neighborhoods. Neighborhoods have been historically disinvested, people who really have things like food deserts and lack of access to healthcare, and bringing in and identifying what are those things that are needed in that community and then delivering on that, and really focusing on how to develop affordable housing and other housing options for people in the neighborhood so they can have quality, safe places to live. Finally, around community pride, team up to clean up. If you haven't done it, we invite you. It's a great way to bring volunteers together to clean up, and often they're neighborhood leaders, neighborhood associations who are wanting to do this, and we go in and we clean the areas. We want everyone to feel pride in where they live. We have our homeless work program that we partner and fund with Old Pueblo Community Services. That also ensures that we're doing major cleanups around the area so that as we're trying to help people, often people are transient in many of these places and leaving behind things. So that work is things that we're really taking up and making sure that's part of our safe city. So now Steve and I are gonna tag team this. And one of the things we wanted to do was talk about some of the gaps that we know and the sources that we used.
So there's a few analysis and reviews that we're conducting currently that have been helpful in kind of shaping a little bit more of what the next iteration of the work would look like. There's Pima County Health Department did a needs assessment in 2014 of September. The City of Tucson created a gaps analysis framework. Actually, that was distributed in February of 2025. Our Justice under Kate Vesley department had been working specifically with sequential intercept mapping. If you wonder what that big SIMS mapping is, it really is taking each point of connections with individuals as they enter the criminal justice system and figuring out the gaps associated with some of their addictions or services that are lacking for them at that time. That map is complete along with TPCH's gap analysis that was conducted in 2024 through 25, excuse me. I think we're seeing how we can take all those that information that's robust and important to begin to kind of craft these areas of improvement that I think are important for us to consider as we move forward. Equally important, as we're kind of partnering, we're also trying to address some of the fragmentation and coordination gaps. There are limited cross-system data sharing. Some of that is very purposeful. Others of it is, we ask why not, right? And so we're trying to figure out how we can connect data systems better, have a lot of people at the table. And equally important is the issues associated with kind of siloed efforts, right? A lot of people doing great work in each of their corresponding areas, but I'm not too sure there's synergy yet that's been created in that space to create not only warm handoffs, but actually have some impact and outcomes that I think our community is expecting from us. And then lastly, at least in my section here, is the treatment and services gaps. We know that there's underutilized delays in authorization. That's a problem. We think, people's health insurance will cover it. Authorization for coverage, particularly as it comes to residential treatment, is very much more difficult than people really think. It's gotten worse, right? And the funding has kind of dried up. For particularly when we look at MAT services and detox long-term recovery facilities, there are beds open, right? But people are unable to go to those beds because they don't have the coverage, right? So when people are waiting and someone's telling them, no, we can't fund you, right? And so that's a problem. And then some delays, crisis response delays, right? And some of that staffing, there's just a lot of overwhelming issues that people are dealing with, which that delay 1 to 2 hours is can be problematic, right, for us. And I'll turn it back over to Liz.
Additional gaps, really, we've heard from the community and through these various sources, the transportation challenges. How do we get people from point A to point B? It seems like such a small, minor issue, but it is really finding where we're dropping people or losing people in getting them to the help that they need. And what you just said, Steve, around the authorization, the difficulty in obtaining access timely. So we had a meeting with Arizona Complete Health and Access representatives to say, explain to me, please, why when people say they leave jail, they can't go straight into a residential bed. Because that would be ideal. Because the minute they leave jail, if they have any time, if they have to wait a week or 2 weeks or 3 weeks, we're going to lose them. So Access explained to us, it's like a pre-authorization. And I'm like, I understand that. I've dealt with that. It's frustrating, and it's a gap that we have right now. Cultural and linguistic barriers, lacking bilingual staff. I think we know that that is always a challenge in making sure we're providing services to people so that they can access it and understand what the requirements or the eligibility requirements are. Around homelessness and housing gaps, this is no surprise. We don't have the number of beds and supportive housing that is the need that we have. We have many encampments that have grown over the years, and we've seen significant issues of safety and environmental concerns. And then discharge planning was one of the things we've heard from frontline staff as people, whether they're leaving jail, hospitals, other types of programs, if you don't have a good plan in place for their exit, you're going to lose them. They're going to go back to what they were doing that got them into that difficulty. So how do we do discharge planning in a way that those connections are there and we can get people through without disruption? Around public safety and justice system, Steve mentioned high failure to appear rates. We know our court staffing, they are maxed out. Our city courts, we are, as we do this work, we know that there's huge numbers. Community court was one of the things I wanted to mention earlier. One of the things we were doing 2 Fridays a month. We've increased that to every Friday, but that required some moving and changing. And I'm very grateful to our presiding magistrate, Judge Klotz, and the work that he's done with Judge Blue. Those things are impactful when we can ensure we're doing this kind of specialty courts to really address these issues that provides on-site services. But we could do that every day and we would still have need around that. Diversion and deflection. Steve knows this better than I, but we're not getting people accepting them at the same levels in the past. And then long booking times does create some issues for us as we're trying to get people arrested and booked and then getting our officers back on the street. Those things are impacting our systems. I'm sorry for the heading here. The heading didn't change, but this heading is really around what are potential collaborations. And actually collaborations already underway, but where can these two elected bodies really focus your efforts? And this is staff recommendation. One, first, thank you to Chair Scott and Mayor Romero for convening the Metro Justice work. We have these work groups. They're working on 4 issues right now. This is, again, city, county, staff, and we're bringing in others that need to be at the table around these big major gaps that we've just discussed. And so we're hoping to bring some recommendations in December around how we address some of these issues. Data sharing across systems, I think there's incredible potential and opportunity here that we haven't really scratched the surface yet. If we can do more of this, we will be able to give those of you, as you make decisions, good information to how to invest. And third, around how do we strengthen partnerships, both at the state level with our regional behavioral health and our nonprofits. And I didn't put in here our faith-based partners. There's lots of opportunities to address these gaps when we strengthen these partnerships. And finally, Steve made mention, there's a potential pilot that we're pulling together this idea around those who are justice involved with substance use. How do we get them, whether it's from the transition center, from the safer center, how do we get them into shelter? Because one of the things we've learned from the transition center is many of them, when they come out of jail, they don't have a place to go. Let's find them a shelter, which the city, we have a project, a property that we've identified that needs, but will need funding because the funding will run out. And how do we get them treatment on site, and how do we get them into residential beds or other transitional housing so that we can ensure that they have a continuum of housing and services that will lead them to being able to be sober and contribute back to the community. So I propose these 4 areas of collaboration, and I appreciate your time and attention.
Thank you so much, Steve and Liz. I, for one, I would highly encourage my colleagues on the Board of